Okay, students. So this talk is on non-accidental injury, and over next 10 minutes or so, what we will do is define what is non-accidental injury, and then I will also discuss with you how to diagnose non-accidental injury, and from exam point of view, discuss few classical features of non-accidental injury. They may not be common, but they are more specific for non-accidental injury. So we'll discuss what is their pathology of those fractures. So non-accidental injury actually is a part of a broader umbrella term called child abuse. And child abuse in simplistic term means any deliberate harm inflicted on a child by any caretaker. So any interaction or even lack of interaction. So now negligence is also part of the child abuse. So any interaction or lack of interaction between family member or caretaker which results in non-accidental harm to child's physical, and now we add developmental state also, which is part of the emotional states, become a part of child abuse, which is a much broader terms. The other terms which are synonymous with this, battering child syndrome or child battering, non-accidental trauma, or shaken baby syndrome, these are all used by different people for the same problem. Then come to a specific pattern of examination. Actually, the commonest fracture are very similar to the common accidental injury. So although we will discuss some specific fracture with the child non-accidental injury, but commonly you see the common fracture. You must rely on other factor, your history and physical examination to corroborate. So 2 and 2 must be suspicious, that you're thinking this 2 and 2 not matching 4, it is 5 or 3, and then you have to be suspicious of non-accidental injury and then look for the specific feature. Metaphysial, so remember the corner fracture and the bucket handle fracture, which are classical or pathognomic of non-accidental injury, actually are in the primary spongiosum transverse fractures. And since some bit of the bone is more protruding, you only see corner and you miss this middle bit because of the X-ray projections. And the same